The doctors had already given up, but the quiet nurse hadn't, were the words whispered years later by people who had witnessed what happened inside room 417 of Harbor Ridge Medical Center. On a cold Tuesday morning overlooking the gray waters of Puget Sound, Admiral Thomas Whitaker stood beside his son's hospital bed with the posture of a man who had spent a lifetime carrying responsibility. At 62, he had commanded ships, led thousands of sailors, and made decisions that affected lives across the globe. Yet nothing had prepared him for the sight of his only son lying motionless beneath the soft glow of medical monitors. 28-year-old Ethan Whitaker had been in a vegetative state for nearly 11 months. Specialists from Boston, San Diego, and Washington, D.C. had reviewed his case. Neurologists had examined every scan. Rehabilitation experts had exhausted every protocol. The conclusion was always the same. No meaningful improvement. No realistic expectation of recovery. No one said the word hopeless in front of the Admiral, but he heard it anyway. He heard it in the pauses between sentences, in the lowered eyes, and in the careful tones of physicians who had run out of answers. That morning, another medical review meeting had ended with more silence than discussion. As doctors filtered out of the room, one of them stopped beside the Admiral and gently placed a hand on his shoulder. "I'm sorry, sir." Nothing more needed to be said. Across the hall, a new nurse quietly adjusted a patient chart before beginning her shift. Her name was Claire Bennett. She was 34 years old, soft-spoken, and had only been working at Harbor Ridge for 3 weeks. Most of the staff barely knew her. Some assumed she was inexperienced because she never joined conversations in the break room. Others thought she seemed too calm for critical care. While nurses traded stories and residents rushed through hallways carrying tablets and coffee cups, Claire moved with measured precision, speaking only when necessary. She arrived early every morning and left long after her shift ended. Few people noticed. Fewer cared. But Claire noticed everything. She noticed the way Ethan's eyes occasionally shifted towards certain sounds. She noticed subtle changes in breathing patterns that never appeared in official reports. She noticed tiny movements dismissed by others as random neurological activity. During her first week, she reviewed every available chart she could legally access. During her second week, she began spending a few extra minutes in room 417 whenever her schedule allowed. By the third week, she had started asking quiet questions that no one seemed interested in answering. Why did certain responses only occur during specific times of day? Why did his heart rate change when military recordings played on television? Why did one hand appear slightly more responsive than the other? Each question was met with the same reaction. Shrugs, polite smiles, gentle reminders that the experts had already evaluated everything. On this particular morning, Claire stepped into room 417 carrying fresh supplies. Admiral Whitaker barely glanced at her. His attention remained fixed on his son. Claire checked the monitors, updated a chart, and prepared to leave. Then something stopped her. It lasted less than a second. Most people would never have seen it. But Claire did. Ethan's right index finger moved almost imperceptibly when a metallic sound echoed from the hallway. Her eyes narrowed. She looked at him again. The room became very still. For the first time since arriving at Harbor Ridge Medical Center, Claire Bennett wondered if everyone else had been looking at the wrong signs all along. Claire remained beside the bed for several seconds after noticing the movement. She did not rush for a doctor. She did not call anyone into the room. Experience had taught her that the smallest observations were often dismissed when presented too early. Instead, she quietly finished checking the monitors and glanced at Ethan Whitaker once more. His face remained still. The room remained silent except for the soft rhythm of machines tracking functions that had shown little change for months. Yet something about that brief response stayed with her. Later that afternoon, Claire reviewed Ethan's records again. Hundreds of pages documented treatments, evaluations, consultations, and specialist opinions. Every report pointed toward the same conclusion: minimal responsiveness, limited neurological activity, poor prognosis. But as she studied the charts, another pattern emerged. Small fluctuations in heart rate appeared at irregular intervals. Tiny changes that most clinicians would consider meaningless. Claire did not. She compared timestamps and noticed several of the fluctuations occurred during visits from former military personnel. The observation might have been coincidence, but it was enough to raise a question. The next morning, she arrived 40 minutes before her shift. The hospital corridors were nearly empty. A maintenance worker pushed a cart down the hallway while the first hints of sunrise colored the windows overlooking the harbor. Claire entered room 417 carrying a tablet and a small portable speaker. She closed the door softly behind her. Ethan remained exactly as he had been the day before. Motionless, quiet, unresponsive according to every official measurement. Claire sat beside the bed and opened several audio files. Most were ordinary environmental recordings. Harbor sounds, rain, footsteps. Nothing changed. Then she played a recording of distant naval activity gathered from a public archive. The faint sound of commands, engines, and deck operations filled the room. Claire watched carefully. For several moments, nothing happened. Then Ethan's heart rate increased by 2 beats per minute. It was small, almost insignificant, but it was measurable. Claire replayed the recording. Again, the same response appeared. She wrote down the time and the exact change. By mid-morning, she had repeated the observation 3 times. Unfortunately, someone else noticed her. Dr. Michael Reynolds, the senior neurologist assigned to Ethan's case, stepped into the room carrying a tablet. He stopped when he saw Claire standing beside the bed. "What exactly are you doing?" he asked. Claire calmly explained her observations. Reynolds listened for less than 30 seconds before shaking his head. "We have already tested auditory responses extensively," he said. "The best neurological teams in the country reviewed this case." Claire nodded respectfully. "I understand that. Then you understand why anecdotal observations are not evidence." His tone was not cruel. It was dismissive. There was a difference. Several minutes later, word of the conversation spread among the staff. A few nurses exchanged amused looks. One resident quietly remarked that the new nurse seemed determined to solve a case that had defeated world-class experts. Claire heard the comments, but said nothing. She simply returned to her work. That evening, Admiral Whitaker arrived as he always did. He pulled a chair beside his son and sat in silence. Before leaving her shift, Claire approached him. "Sir," she said carefully, "I believe your son may be responding to certain types of stimuli." The Admiral looked up slowly. Months of disappointment had taught him to be cautious with hope. "Doctors have told me many things," he replied. "Most of them led nowhere." Claire held his gaze. "I am not offering hope, sir. I am offering an observation." For the first time, Admiral Whitaker studied her more closely. The young nurse, who rarely spoke, seemed unusually certain about something. And certainty was becoming very difficult to ignore. The following morning, the atmosphere around room 417 felt different, although nobody could have explained why. Claire Bennett continued her routine exactly as before. She checked medications, reviewed overnight notes, and monitored every detail recorded by the equipment surrounding Ethan Whitaker's bed. Outwardly, nothing had changed. Inwardly, she was assembling pieces that did not fit the conclusions everyone else had accepted. Shortly after 8 o'clock, Dr. Reynolds entered the room accompanied by 2 residents. He reviewed the monitors, glanced at Ethan, and prepared to leave. Before he reached the door, Claire spoke. "Doctor, I would like permission to conduct a structured response assessment." Reynolds sighed quietly. "We have conducted dozens. Not this version." The neurologist turned back toward her. "Claire, I appreciate your dedication, but this case has been evaluated by specialists with decades of experience." "I know," she answered calmly. "I only want 10 minutes. One of the residents exchanged an amused look with the other. Reynolds folded his arms. "And what exactly makes this assessment different?" Claire hesitated for a moment. "The sequence of stimuli." The answer seemed to irritate him more than impress him. "You believe a sequence of sounds will succeed where entire neurological programs failed." Claire did not argue. "I believe it is worth verifying." Reynolds shook his head and left without granting approval. The conversation ended there, but not before Admiral Whitaker, who had arrived earlier than usual, overheard every word. For several minutes, he remained silent beside his son. Then he turned toward Claire. "What is it you think you are seeing?" She looked at Ethan before answering. "Not seeing, sir. Recognizing." The Admiral studied her expression. "Explain." Claire pulled a chair closer and opened a notebook filled with carefully organized observations. She showed him timestamps, monitor readings, and recorded responses. Tiny changes, barely noticeable patterns. Nothing dramatic. Nothing that would convince a room full of specialists. Yet together they formed a picture that refused to disappear. "These responses occur around specific auditory triggers," she explained. Not random sounds. Familiar sounds. The Admiral examined the notes. Military sounds. Yes, sir. He stared at the pages for a long moment. My son spent most of his life around naval personnel. Exactly. Claire paused. The brain sometimes holds onto pathways that training reinforced for years. The Admiral looked back toward Ethan. Hope was dangerous. He knew that better than anyone. Yet something about the nurse's confidence felt different from the optimism he had heard before. She was not promising recovery. She was following evidence. That afternoon, after receiving no approval from hospital leadership, Claire waited until her regular patient care duties were complete. Then she returned to room 417, carrying nothing more than a tablet and a legal notepad. Admiral Whitaker sat quietly in the corner. Without ceremony, Claire began a carefully timed sequence. Short audio cues, precise pauses, consistent repetition. Her focus never left Ethan's face. 5 minutes passed. Nothing happened. 10 minutes passed. Still nothing. The Admiral lowered his eyes. Then Claire played a brief metallic signal followed by a calm command spoken in a firm, measured tone. Suddenly, Ethan's breathing pattern changed. Not dramatically, not enough to alarm anyone, but enough for Claire to notice instantly. She leaned forward. The monitor confirmed it. A measurable response. Then, for the second time in less than 48 hours, Ethan's right index finger moved. This time Admiral Whitaker saw it too. The room fell completely silent. For several seconds neither Claire nor Admiral Whitaker spoke. The only sound came from the steady hum of the equipment surrounding Ethan's bed. The Admiral slowly rose from his chair and stepped closer. His eyes remained fixed on his son's hand, as if he feared the movement might vanish if he blinked. "Did you see that?" he asked quietly. Claire nodded. "Yes, sir." The Admiral looked toward the monitor, then back to Ethan. After 11 months of disappointment, he refused to trust his own emotions. "Could it be random?" he asked. Claire did not answer immediately. She reviewed the readings on the screen and compared them to the notes she had recorded earlier. "Anything is possible," she said carefully. "But random events do not usually repeat themselves after the same stimulus." Before the Admiral could respond, the door opened. Dr. Reynolds entered the room carrying a chart. One glance told him something unusual had happened. The Admiral immediately explained what he had witnessed. Reynolds listened with a professional expression that revealed little. When Claire described the sequence she had used, the neurologist's face tightened. He reviewed the monitor logs and studied the recorded changes. The numbers were real. Small, but real. Even so, he remained unconvinced. "A single observation does not overturn nearly a year of clinical data," he said. "We need consistency. We need evidence." Claire agreed. "Then let us collect it." Reynolds frowned. "You are a nurse, not a neurological researcher." The room grew quiet. The Admiral noticed that Claire showed no sign of embarrassment. She simply met the doctor's gaze. "I am aware of my position," she replied calmly. "I am only following what the patient is showing us." The neurologist folded his arms. "And what exactly do you think he is showing us?" Claire looked toward Ethan. "That he may still be processing more than we assumed." Reynolds shook his head. "Or that we are seeing what we want to see." Without another word, he left the room. The conversation might have ended there, but hospital staff quickly learned that something unusual had occurred. By the following morning, several nurses were quietly discussing the incident. Some were curious. Others were skeptical. A few dismissed it entirely. The new nurse had found a miracle, they joked. Claire ignored every comment. She spent the next 2 days documenting responses with almost obsessive precision. Every sound, every pause, every change in breathing, every fluctuation in heart rate. Patterns slowly began to emerge. None of them were dramatic. Yet together they formed something difficult to explain away. On the 3rd day, Claire requested permission to conduct a longer observation session. Hospital leadership denied the request within hours. The official explanation cited existing treatment protocols. Unofficially, nobody wanted a newly hired nurse challenging conclusions reached by nationally recognized specialists. That evening, Admiral Whitaker found Claire reviewing her notes alone in a quiet corner of the hospital library. Stacks of medical journals surrounded her. She looked more like a researcher than a bedside nurse. "You expected them to say no, did you not?" the Admiral asked. Claire closed her notebook. "Yes, sir." "Then why keep pushing?" For the first time since they had met, she seemed to hesitate. Her eyes drifted toward the harbor outside the window where evening sunlight reflected across the water. "Because I have seen people come back when everyone believed they would not," she answered softly. The Admiral studied her face. There was no arrogance in her voice, no desire for recognition, only certainty. A certainty that seemed to come from somewhere far beyond an ordinary hospital career. And for the first time, Admiral Whitaker began to wonder where Claire Bennett had learned to recognize signs that so many experts had missed. The questions surrounding Claire Bennett continued to grow. Nurses who had barely noticed her a month earlier now watched her with curiosity whenever she entered the intensive care unit. Residents quietly discussed her observations in hallways. Some dismissed her findings as coincidence. Others were no longer so certain. Meanwhile, Ethan Whitaker continued producing small responses that refused to fit neatly into established conclusions. Every documented reaction was subtle, yet each one appeared under controlled conditions. Claire recorded everything: time, stimulus, heart rate changes, breathing patterns, finger movement. She treated every observation with the discipline of someone who understood that assumptions could destroy credibility. 3 days later, Dr. Reynolds called a formal review meeting. Around the conference table sat neurologists, rehabilitation specialists, administrators, and Admiral Whitaker. Claire was invited only because her reports had become impossible to ignore. The atmosphere felt tense from the beginning. Reynolds projected graphs and charts onto a screen. He acknowledged the documented changes, but emphasized their limited significance. "These observations do not prove meaningful recovery," he said. "They do not demonstrate awareness, cognition, or communication." Several physicians nodded. The hospital administrator appeared relieved by the statement. Then Claire was asked to explain her position. She stood quietly at the end of the table. Unlike everyone else, she brought no presentation, only a notebook. "I agree that we do not have proof of recovery," she said. "But I do believe we have evidence that further investigation is justified." A specialist leaned forward. "Based on what?" Claire opened her notebook. "Pattern recognition." A few people exchanged skeptical looks. She continued anyway. "The responses occurred during specific sequences. Not random exposure. Not isolated sounds. Structured sequences." Reynolds sighed. "You continue referring to these sequences as though they carry special significance." Claire met his gaze. "Because they do." The room fell quiet. "Explain," Reynolds said. Claire paused. For the first time, she seemed reluctant. Certain training environments use highly repetitive stimulus patterns to establish rapid recognition under stress. The brain learns to prioritize them. One of the neurologists frowned. "Military training?" Claire nodded. Before she could continue, another physician interrupted. "And where exactly did you learn this?" The question hung in the air. Claire looked down at her notebook before answering. "From experience." It was not the answer they wanted. The meeting ended without approval for expanded testing. Officially, nothing changed. Unofficially, everything had. As participants filed out, Admiral Whitaker remained seated. He watched Claire gather her notes in silence. "You still are not telling us everything," he said after the room emptied. Claire offered a faint smile. "No, sir." "Why?" She considered the question carefully. "Because this is about your son, not about me." The Admiral studied her face. For a moment, he saw something behind the calm professionalism. Not arrogance. Not secrecy for its own sake. Something older. Something earned. Later that evening, Claire returned to room 417 after finishing her shift. The unit was quiet. Most lights had been dimmed for the night. Ethan remained motionless as always. Claire pulled a chair beside the bed and opened her notebook. Then she spoke a short sequence of words in a steady, measured tone. The phrases sounded unusual, deliberate, almost rehearsed. Several seconds passed. Nothing happened. Then Ethan's breathing changed again. Claire carefully documented the response. As she lowered her pen, a voice came from the doorway. "I knew I recognized that sequence." Claire looked up. Standing in the hall was a gray-haired visitor wearing a retired Navy commander's jacket. His expression had gone pale. And for the first time since arriving at Harbor Ridge Medical Center, someone appeared to recognize exactly what Claire Bennett had been doing. Claire slowly closed her notebook and stood from the chair. The retired commander remained in the doorway, his eyes fixed on her with unmistakable recognition. For several moments, neither spoke. The quiet hum of the intensive care unit filled the space between them. Finally, the man stepped into the room. I have not heard that sequence in almost 15 years, he said. His voice was calm, but there was weight behind it. Claire seemed unsurprised. Most people have not, she replied. The commander's gaze shifted briefly toward Ethan before returning to her. Those response patterns were never part of standard medical training. Claire remained silent. The commander gave a faint nod, as though her silence confirmed more than any answer could. The following morning, rumors spread through the hospital faster than usual. Someone had seen a retired Navy commander speaking privately with the new nurse. Someone else claimed the commander had addressed her with unusual respect. By lunchtime, speculation had become a favorite topic in staff lounges and nursing stations. Claire ignored all of it. Her attention remained focused on Ethan. Meanwhile, Admiral Whitaker found himself replaying the previous weeks in his mind. Every conversation, every observation, every moment when Claire had noticed something others missed. The pattern was becoming impossible to dismiss. Late that afternoon, he arrived to find Claire conducting another carefully documented session. This time she was not using recordings. Instead, she spoke several short instructions in a calm, measured rhythm. The phrases sounded simple, almost ordinary, yet they carried a cadence unlike normal conversation. Ethan remained still for nearly a minute. Then his breathing changed again. The monitor reflected a measurable response. Not dramatic, not miraculous, but real. Admiral Whitaker watched in silence. For the first time in months, he no longer looked at the equipment. He watched his son. Dr. Reynolds arrived moments later after receiving another notification regarding unusual readings. He entered expecting to find another minor fluctuation. Instead, he found Claire calmly documenting yet another repeated response. Frustration flashed across his face. "This is becoming a distraction," he said. "We are assigning significance to events that may have no clinical meaning." Admiral Whitaker surprised everyone by answering before Claire could speak. "Then explain why they keep happening under the same conditions." Reynolds hesitated. The question was fair. More importantly, it was becoming difficult to answer. The neurologist reviewed the latest data. Every measurement remained small, yet the consistency was undeniable. For the first time, uncertainty appeared in his expression. As evening settled over Harbor Ridge Medical Center, the retired commander returned. This time he carried a thin folder. He approached Admiral Whitaker privately outside room 417. "Your son is fortunate," he said quietly. "Why?" the Admiral asked. The commander glanced through the glass toward Claire. "Because very few people would have recognized what she recognized." Admiral Whitaker looked at him carefully. "Who is she?" The commander was silent for several seconds. Then he answered, "The better question is where she learned to see things the rest of us miss." Inside the room, unaware of the conversation, Claire continued watching Ethan. Then something happened that had never appeared in any chart, report, or evaluation during the previous 11 months. As she repeated one final verbal cue, Ethan's eyelids trembled noticeably for the first time. Not a reflex, not a fraction of movement. A visible response that lasted long enough for everyone in the room to see. Ethan's eyelids settled again, but the room was no longer the same. Dr. Reynolds stared at the monitor as if the numbers might offer an explanation that his years of training could immediately categorize. None came. The response had been brief, yet everyone present had witnessed it. No one needed a chart to confirm what they had seen. Admiral Whitaker remained motionless beside the bed. For months he had trained himself not to react to hope. Hope had become dangerous. Hope had become exhausting. Yet this felt different because it had happened in front of him. Not in a report. Not in a specialist summary. In front of his own eyes. Claire quietly documented the event, writing down the exact time and circumstances. Her hand remained steady. She showed no celebration and no visible excitement. That calmness only made the moment feel more significant. Dr. Reynolds finally broke the silence. "We need additional testing immediately." It was the first time he had spoken with urgency rather than skepticism. Within hours, Ethan underwent a new round of neurological assessments. Technicians moved equipment in and out of the room. Specialists reviewed data. Administrators suddenly found room in their schedules for emergency consultations. The same hospital that had dismissed Claire's observations now seemed determined to understand them. Throughout the process, Claire stayed in the background. She answered questions when asked and otherwise returned to her normal duties. Several staff members who had once ignored her now approached with curiosity. Some wanted to know how she had noticed the patterns. Others wanted to know where she had learned the unusual response sequences. Claire gave the same polite answer every time. I paid attention to the patient. The retired commander watched these interactions from a distance. Late that evening, he found Admiral Whitaker standing alone near a window overlooking the harbor. The city lights reflected across the dark water below. "You still have questions?" the commander said. The Admiral gave a faint smile. "More than ever." The commander nodded. "So did I the first time I met her." Admiral Whitaker turned toward him. "You know her?" "Not personally, but I know of the program she came from." The Admiral waited. The older man lowered his voice. "Years ago, a small group of military medical specialists received training that combined neurological recovery techniques, behavioral response recognition, and operational psychology. Their job was simple in theory and nearly impossible in practice. They worked with service members who were considered unreachable." Admiral Whitaker's expression hardened with concentration. "And Claire was part of that. One of the best, from what I heard." The Admiral looked through the glass toward room 417, where Claire was quietly updating Ethan's chart. She looked exactly the same as she had on her first day. No medals, no announcements, no desire for attention, just a nurse doing her job. Yet the story surrounding her was becoming larger with every passing hour. The next morning brought another surprise. During a controlled assessment supervised by specialists, Ethan responded to a verbal sequence with a measurable change that exceeded anything previously recorded. The room erupted with activity. Doctors exchanged stunned looks. Technicians rechecked equipment. Nobody wanted to believe a mistake had been made. But there was no mistake. For the first time in nearly a year, the evidence was beginning to point in a new direction. And standing quietly at the edge of the room, Claire Bennett looked less like a new nurse and more like someone who had been waiting patiently for everyone else to catch up. Ethan's progress became the center of attention throughout Harbor Ridge Medical Center. What had started as a few subtle responses was now supported by a growing collection of documented evidence. Specialists who had once viewed Claire Bennett's observations with skepticism were now reviewing her notes line by line. Some remained cautious. Others were beginning to reconsider assumptions they had held for nearly a year. Yet the greatest change was not occurring in conference rooms or medical reports. It was happening beside Ethan's bed. Every day brought small but measurable improvements. His responses remained limited, but they were no longer isolated events. Patterns were emerging. Recognition appeared to be returning one layer at a time. During one assessment, Ethan responded to verbal cues with a consistency that surprised even the most experienced neurologists. During another, his eyes tracked movement for several seconds longer than expected. Each step was modest. Together, they represented something extraordinary. Admiral Whitaker spent more time at the hospital than ever before. For months he had entered room 417 expecting disappointment. Now he entered carrying cautious optimism. One afternoon, he found Claire reviewing charts near the nurse's station. "You knew this was possible before anyone else," he said quietly. Claire shook her head. "No, sir." "Then why were you the only one looking?" She thought for a moment before answering. "Because everyone else was looking for proof that he could not improve. I was looking for evidence that he could." The Admiral remained silent. It was a simple statement, yet it explained more than any medical report. Later that week, Dr. Reynolds requested a private conversation with Claire. They met in an empty consultation room overlooking the harbor. The neurologist placed several folders on the table. "I owe you an apology," he said. Claire looked genuinely surprised. Reynolds gave a small smile. "Not because you were right and I was wrong. Medicine is rarely that simple. I owe you an apology because I stopped asking questions." For several seconds, neither spoke. Then Reynolds leaned forward. "The commander was right, was he not?" Claire knew exactly which commander he meant. "About what?" she asked. "About where you learned this." She looked out the window, toward the water before answering. "A long time ago, I worked with people recovering from severe neurological trauma. My job was to notice things others overlooked." Reynolds studied her carefully. "Military patients." Claire nodded once. "Some of them." The neurologist slowly exhaled. Many pieces suddenly made sense. Her discipline, her observation skills, her unusual response sequences, her refusal to seek recognition. Everything fit together. Word of Ethan's improvement eventually reached people far beyond the hospital. Former colleagues visited. Friends returned. Several retired service members stopped by simply to check on the Admiral's son. Among them was the retired commander who had first recognized Claire's methods. Standing quietly outside the room one evening, he watched Ethan complete another successful response assessment. Then he turned toward Claire. "You never tell them the whole story, do you?" Claire smiled faintly. "It is not my story that matters." The commander nodded. He understood. Some people spent their lives demanding credit. Others spent their lives earning it quietly. As the sun set beyond Puget Sound, casting golden reflections across the water, Admiral Whitaker watched his son respond to another sequence of familiar cues. Then he looked toward Claire Bennett. For the first time since she arrived at Harbor Ridge Medical Center, he no longer saw a new nurse. He saw someone whose calm expertise had changed the direction of a life that everyone else had already written off. Over the following weeks, the atmosphere at Harbor Ridge Medical Center transformed completely. What had once been considered an impossible case was now discussed in terms of progress, rehabilitation, and future milestones. Ethan Whitaker continued responding to treatment with steady improvement. The changes were not dramatic from one day to the next. They were the kind of victories that required patience to appreciate. A longer response during therapy, increased awareness of voices, more consistent eye tracking, small steps that together formed a path forward. Admiral Whitaker never forgot how that path had begun. One quiet morning, nearly 2 months after the first documented responses, he entered room 417 carrying a folder. Ethan was awake, resting comfortably, and participating in a supervised rehabilitation session. Claire Bennett stood nearby reviewing charts as she always did. The Admiral approached her after the session ended. Without a word, he handed her the folder. Inside was a formal letter of appreciation signed by military leaders, hospital administrators, and medical specialists who had followed Ethan's recovery. Claire glanced at the first page and immediately closed it. "Thank you, sir," she said softly. "But this belongs to everyone who helped him." The Admiral smiled. "That sounds exactly like something you would say." Claire returned the folder. "Because it is true." For a moment neither spoke. Then Admiral Whitaker did something that surprised several staff members nearby. He stood perfectly straight and offered Claire a respectful salute. Conversation stopped. Nurses paused in the hallway. Even Dr. Reynolds looked up from his tablet. Claire seemed slightly uncomfortable with the attention. After a brief hesitation, she returned the gesture with quiet respect. Nothing more was said. Nothing needed to be. Later that afternoon, Dr. Reynolds found Claire cleaning and organizing supplies in a storage room. "Most people would be celebrating," he remarked. Claire smiled faintly. "There is always another patient who needs help." Reynolds shook his head with amusement. "You know, when you first arrived, I thought you were simply an unusually observant nurse." "And now?" Claire asked. "Now I think observation is only a small part of it." She did not answer. The neurologist laughed softly. "You still are not going to tell me everything, are you?" "No, Dr. Reynolds. I did not think so." Several weeks later, Ethan was transferred from intensive care into a specialized rehabilitation program. The day he left room 417, many staff members gathered quietly in the hallway. Some had cared for him for months. Others had joined his journey more recently. As he was wheeled toward the elevator, he turned his head and found Claire standing near the back of the group. His voice was still recovering, but he managed a few clear words. "Thank you." Claire nodded. "You did the hard part." The elevator doors closed. The hallway slowly returned to normal. Patients still needed care. Charts still needed updating. Life continued. By the end of her shift, Claire gathered her belongings and prepared to leave. As she walked through the hospital entrance, evening sunlight reflected across the waters of Puget Sound. Behind her, inside a building filled with experts, technology, and experience, one lesson remained impossible to forget. Sometimes the difference between giving up and moving forward is a person willing to notice what everyone else overlooked. Claire Bennett never raised her voice. She never demanded recognition. She simply paid attention when others stopped looking. And in the end, quiet competence proved louder than certainty. Respect is earned in silence.